That's really cool. I'm excited. I've heard of Westchester, never heard of Eastchester. Okay, great. All right. Thank you, everybody. Welcome to Save Lives, Don't Take Them, a panel discussing removing the NYPD from the mental health crisis response process. My name is Jamali Hamilton, and I'm the manager of public policy and advocacy at NAMI New York City. As a reminder, this presentation is being recorded and streamed to Facebook, so welcome to anyone watching via Facebook. For those of us on the Zoom call, I'm going to be keeping everyone muted except for our speakers, but please feel free to put comments and questions in the chat. For those of you joining via Facebook, feel free to comment on the live stream and your questions will be passed on to me. We have a team of incredible moderators in the chat, so in both the Facebook and Zoom chat, so they will be helping out this entire time. If you are calling in and you don't have access to the chat, or if questions come up after the presentation, you can email me at advocacy@naminyc.org. Again, this presentation is being live streamed on Facebook. So if you enjoy the presentation or would like to share it afterwards, you can find the recording on NAMI NYC page under the videos. This event is co-presented by the National Alliance on Mental Illness, also known as NAMI New York City, and the Police Reform Organizing Project, also known as PROP. Our co-sponsors include Vocal New York, CCIT NYC, Fountain House, and the Office of the New York City Public Advocate, Jamali Williams. Thank you so much to our co-sponsors, and especially thank you to our co-presenter, PROP, for helping us plan this panel and bringing this panel, the idea for this panel to us a few months ago. This event is especially timely, I believe, given that this month is Minority Mental Health Month. And unfortunately, we know that people of color are often most impacted by our failing mental health response system. So without further ado, I want to get into the conversation with our incredible panelists. Just so you know, our panelists include, we have Jamali Williams, New York City Public Advocate, Peggy Herrera, a community activist, Tiffany Caban, National Political Organizer for the Working Families Party, and Tim Black, White Bird Clinic in Oregon, and the host of the Cahoots. He's from the White Bird Clinic in Oregon and host of the Cahoots program, which we're going to hear more about. So I want to hear from our panelists rather than hearing from me. I think I've talked enough. So let's begin with Tiffany Caban, please. Please introduce yourself and explain to us, how have you been involved in crisis response work?
Sure. First of all, thank you for having me. It's super dope to be in conversation with these incredible folks. When we were in our green room doing the sound check, I was saying what a big fan of Peggy Herrera I am. So just happy to be in conversation with y'all. But yes, so I come at it from a different arena, I think, than some of the other folks. My formal introduction to the intersection of mental health and policing is through my experience as a public defender. I was a public defender at the Legal Aid Society and then New York County Defender Services for about 7 years. And in that time, every single day I saw families that, were experiencing and dealing with mental health issues, didn't have the support, and saw what happened when they got these ill-equipped responses involving our criminal legal system. And not only that, but once they became criminal justice system involved, how those harms were exacerbated, right? And things just weren't getting better. And I think that the work is sort of twofold, and you can see it through that lens of what happens after the arrest in the courtroom, is that the arrest itself is violent, right? But also everything that comes after it is violent. So in that initial interaction, there's a real risk of death, of severe harm, of injury. But when the person in crisis comes in contact with this entity, which is an entity with a monopoly on violence, with only one kind of tool in their toolbox, and let's say they survive that interaction, what happens when they get to court and how they're dealt with within the criminal legal system. My work now is a little bit different. I moved on from doing public defense work, and I am a national political organizer with the Working Families Party. My work primarily is centered on trying to elect decarceral district attorneys around the country, but the connection to policing and getting policing out of our public health issues and public health responses is very, very real. At the core of my work for electing decarceral prosecutors is this idea that the definition of a decarceral prosecutor is somebody that clearly is committed to harm reduction, to shrinking their role within the system, and to outsourcing, because we have allowed public health issues to be punted to our criminal legal system. So there's a very real role to be played within that, of destigmatizing and decriminalizing these things so that we can start demanding and putting pressure on proper public health infrastructures to be built to deal with folks that are in mental health crisis, for example. And so a large part of that work is also just narrative shifting through strategic campaigns, and also supporting groups on the ground and advocates like Peggy Herrera doing their work and kind of trying to increase their capacity to get the responses that we want in these moments. So that's a little bit about the work that I'm doing, and I am very, very excited to be here with y'all.
Thank you so much. I really appreciated that. Public Advocate Jamali Williams, can you please introduce yourself and talk about how you've been involved in crisis response crisis response work? Oh, I think he's still muted. Can somebody unmute the Public Advocate, please?
Thank you. You gave your speech about not muting after I had already muted, so.
Sorry about that.
Stuff. But thank you so much for having me, and it's great to be on this panel and having this discussion at this critical moment. I come to this space really trying to figure out how we redefine public safety, generally speaking, and trying to figure out what public safety means and what law enforcement's role is in public safety. I always say, people think the law enforcement has no role. No, they're wrong. People who think they have the only role or should have an outsized role, they're also wrong. So it's trying to figure out where our partners fit in, who are often not being discussed. And some of that is more interesting than others, like mental health. Why are our law enforcement agencies responsible for our mental health? Why are they the first people responding to crises when people are actually asking for a health solution? And people have called 911 thinking they were going to get someone who could provide some medical assistance for people who are in medical emergencies, and they have sadly gotten a criminal response. And that criminal response actually extends even after, as Tiffany was saying, the police, one of the largest probably mental health institution in the city and maybe in the nation, is Rikers Island, because there are a lot of people who have mental health issues that are not getting the services they need, but they've gotten a criminal response. And we kind of see this in other places. We've criminalized homelessness, we're criminalizing a lot of different things. And mental health, sadly, is one of them. And there are actual avenues where people can get the service they need, not get criminalized repeatedly, because very often that leads to a cycle of damage to the individual, to their family, and to the larger community. And I always want to point out this really unfair to the community. It's also unfair to the men and women in blue who probably came to work wanting to provide some help for communities, many of them, but they have a gun, a baton, a taser, a summons book, and those things can't solve the problems that they're asked to solve on a regular basis.
Thank you very much for sharing that. Peggy Herrera, can you please introduce yourself and tell us how you've been involved in crisis response work, please? Uh-oh, she also muted. Let's see.
I think she may have gotten disconnected. I'm not seeing her listed.
Okay, we'll reach back out to Peggy to figure out how we can get her reconnected. But in the meantime, Tim, can you please tell us a little bit about, can you introduce yourself and let us know how do you work in mental health response work?
Sure. Thank you all for this opportunity tonight. I'm really excited for the discussion we're going to have. My name's Tim Black. I use he, him pronouns. I'm the director of consulting for Whitebird Clinic, but for the last 10 years, I've worked on the Cahoots team, first as a full-time first responder doing the crisis side of the response team. And then for the last 6 years, I served as the operations coordinator, which put me in contact with our elected officials locally, frequent collaboration with law enforcement and other public safety personnel on really, making sure that the Cahoots services that are being offered out in our community are happening in a timely fashion and are, really responsive to the needs of our community. Prior to working on Cahoots, I did work in housing and street outreach, as well as crisis intervention for youth and young adults. So crisis has been my bread and butter for quite a while. And yeah, I'm so excited to be here, with all of you talking about this tonight.
Absolutely. Thank you so much for sharing that, Tim. So hopefully we're going to try to find Peggy. Not sure where she could have gone, right? Because we should all be quarantined inside our homes, but we're going to try to find Peggy. And in the meantime, just want to provide a little bit of context for folks in the sense that when we're talking about mental health crisis, we're really talking about mental health emergencies, right? So really what happens when someone is having a mental health emergency and needs assistance. And so I really appreciate our panelists for describing how they've been involved in making sure that folks, and when we talk about folks, I mean both families and individuals, how to make sure both families and individuals impacted by a mental health crisis are able to get the help they need. So let's jump right into it. I'm gonna go back to Tim. Let's start with you. Tim, why should police, so this is called Save Lives, Don't Take Them, removing NYPD from the crisis response system. Why should police not be first responders for mental health emergency calls?
That's a great question to get us started with. I think, when we talk about these first responders, right, and who goes to what type of issue that emerges in the community, to me, it goes back to, what kind of tools are you bringing out of the toolbox to address an issue? And right now, we see in communities across the US that law enforcement is used as a hammer in a lot of different situations. But when it comes to behavioral health, when it comes to these mental health emergencies and these crises that are emerging out in the community, we're looking at more of a plumbing issue, right? And that's where we need to be bringing in wrenches and towels to clean up, not just hitting things with the hammers. So it's on a very surface level, very fundamental. This is about sending the right resources to the need. When we look at what first responders look like when they appear on scene, with an officer, you get that uniform, you get that badge, that gun, taser, pepper spray, as Jamali Williams mentioned, that summons book, a lot of power, a lot of means of enforcement, a lot of tools to escalate a situation physically, all come with that responder to a scene. And what we need to be asking in these conversations is why is it that we're sending enforcement, that we're sending tools to really subdue somebody to a situation that doesn't have an emergent crime being committed? There's not, a loss of life. Who is it that you're sending? And with behavioral health first responders, there's an opportunity, even just on the visuals of who it is that's showing up on a scene, to show folks that when they're in crisis, they're going to get a response. They're not going to get locked up or hauled off to jail against their will. They're going to get somebody who's there to really talk with them. And that really starts with looking at who's responding and how they're responding. I think, a key difference with how Cahoots responds to these situations compared to law enforcement is really that visual of, us showing up in jeans and a hoodie, driving a white van, as opposed to showing up in a patrol car with that uniform on, with those weapons, with all of those tools that for many communities across the US mean oppression at best and more likely violence. That's also just my perspective here in Oregon. So, I think that there are a lot of other, good points that our other panelists could bring to this too.
Yes, thank you so much for that. Really appreciate that. Public Advocate Jamali Williams, can you please share, why, the question is, why should police not be first responders for mental health emergency calls?
The question also, we should really look at this, why would they be first responders, right? So you are calling police normally when there is a criminal issue, something that is a criminal. And we keep repeating the same mantra that these folks need assistance. And so if you call and say, God forbid, someone is having a heart attack someone, God forbid, is having a stroke, something like that, it wouldn't be the police that's showing up. It would be ambulance and people who can provide the medical assistance that's needed. Part of it is we still have a stigma attached, I think, to to mental health, generally speaking. This is another conversation that we have to break down. But in that, we are now viewing it as the medical crisis that it actually is. And as Tim was mentioning, when someone shows up in that uniform that's associated with criminal response, with many people viewing it as escalation, they're showing up with that gun, that squad car that may have the lights and all this attention. If someone's in that kind of crisis, it seems to me that it would only heighten the situation. And we have also made, sadly, mental health sometimes synonymous with violence, when the vast majority of people who have mental health issues are not violent at all. And so police are called to areas, and sometimes I'll hear, well, what if something goes wrong? That's the same question you can ask any EMT that goes to any medical response. If something goes wrong and you need some assistance, then you call the police, but you don't show up with the police like something inherently is going to go violent just because someone needs a mental health response. And so a lot of this is common sense when you really break it down, but it's difficult to break down because we have these notions in our head, and we have to take time to break down those notions as we move forward. But it is careful. We have to be careful when we have the discussions that we address people's concerns, because sometimes people wanting to feel safe can be more dangerous than anything else. And so we have to be clear that we do want you to be safe. We also want you to feel safe. And the things that we're proposing can actually address both, but we should never underestimate the preconceived notions that people have and what we need to do to break that down. But someone who's in a state of mental health crisis, it is clear, everyone would agree that that person needs, once you talk to them, some medical assistance. And the question is, well, why are we sending criminal response?
Thank you so much for that, and for really framing that, in the sense that if we can agree that if someone is in a mental health crisis, they need help, they need assistance, then what does it mean that we call the police? It really does add to the criminalization of having a mental illness, and it does absolutely frame how we consider someone living with a mental illness as someone with a problem that needs to be handled. So thank you so much for sharing that. I think we have Peggy on now. Peggy, can you hear me?
Yes. Do you hear me?
Yes, I can, Peggy.
Great.
Thanks so much. So I would
Great.
love if you could, you missed introductions, but we would love for you. I want to go back. So if you could just introduce yourself and talk about the work that you've done. How have you been involved in crisis response work?
Okay, so as some of you know, I see a lot of people that I know. I am a member and a leader of the Close Rikers campaign. I am a community activist, and I am a mother of a son who suffers from mental health issues. So I think that in just being a mother and working with young people that deal with mental health, I think that mental health is looked on as a weakness. Mental health is not a crime. So every day that my son walks out these doors is a concern for me on how police will respond to him when he's going through a crisis. So we can look at people every day and just assume, and as they use the word crazy, and he's just going through a crisis and be criminalized for that and possibly even being killed just for going through a crisis. So it's a big concern of mine. Going through the situation that I went through with my son, I understand that police are not trained and can never be trained. See, passion is something that we cannot train people to be. Compassion is something that comes from the heart. And so if you're gonna do a job that deals with people in crisis, you have some kind of compassion. Cahoots definitely has the right idea. I love their idea. For all the work they do it for half the price for what a police officer does. So we definitely can afford a Cahoots program here as opposed to police. So, basically I am very involved. I sit on the committee with CCIT NYC and just go around advocating making sure that police do not respond to mental health crises. They're not trained to do the job.
Thank you so much, Peggy, for sharing that, for sharing your story, how you've been involved, and really, I think, I think drawing a link between, why, one of the question, you kind of answered the question that you didn't hear, but why should police not be involved? Why should police not be first responders to mental health emergency calls? I think you've laid out some reasons pretty clearly, and one of them is really, I think, thinking about training, right? Like, ultimately, empathy is a very hard skill to train in, right? So if someone's responding to a mental health call, it really has to be something that they've wanted to do. And actually, yeah, and that's something that other programs that do train police do believe that police should self-select into that anyway. Tiffany Caban, I would love for you to answer this question before we move on to the next one. Why should police not be first responders for mental health emergency calls? Oh, she's muted. Can someone unmute her?
Oh gosh.
I've been muting in between because I have dogs and I'm holding out hope that they stay quiet. So they've been all right though. I think the folks have really, really hit the nail on the head. So I don't want to be repetitive, but the one thing that I will add to the piece about police not being first responders for mental health emergency calls is also just taking a step back and having that, 60-foot view from above and looking at our allocation of resources. And Peggy started to talk about that. When we continue to buy into this idea that the police are the people that should be responding to these things, we give them the resources to respond to these things. I think, looking at it through the lens of our current health pandemic provides some really good examples. We had our police commissioner on any given day early on in the pandemic saying, hey, we've got 1,000, 2,000 officers calling out sick, but don't worry, we can fully staff our shifts. But we had nurses begging for safer staffing and PPE. And so understanding if these are the folks that aren't equipped to be their first responders, certainly they're not in the police academy going over, the DSM and how to deal with folks that are in mental health crisis and all this. It's not what they're trained to do. But when you recognize that and you start pulling back and taking away some of those resources and reallocating them, then we create the conditions for being able to have the appropriate kind of first responder. And that's the only thing I'll add, because I think that everybody else really, really covered the topic pretty thoroughly.
Excellent. Thank you so much for that. I'm going to move on to our next question now. And I'm going to go to Peggy. I'm going to go to Peggy first. This is for Peggy. Does anyone have any personal experience with our broken crisis response process that they feel comfortable sharing about?
Yes. So on August 25th, 2019, my son had a mental health crisis. And I called for the police, as I usually did, and I called for police. And when they came, my son wouldn't open the door because, of course, the uniform is already one of his fears. He can either be arrested, he's already had that treatment before. So he wouldn't open the door, which led to counseling through my window. I live on the first floor. So he was counseled by an officer on the first floor. And that happened for 40 minutes. My son was calm. They saw him. He was fine. EMS was there. I would not let them in either way until EMS arrived. But one of the reasons I have a problem with EMS was because they gave permission. Well, they gave the freedom for police to do whatever they wanted. They said, whatever the police say, that's what gets done. And so I disagree with that, because EMS is trained, police are not. So for 40 minutes, they counseled him, and 40 minutes later, a big truck showed up at my door with these big tools and shields, ready to break my door down. They came to me, took me right down. They never once asked me to move. They just took me down, dragged me to the corner, put me in handcuffs. I was screaming for my son because I thought they were going to kill my son. And I wind up in jail for the night. And my son went to a hospital for 2 minutes, never got the help he needed. And I ended up arrested and in jail for the night. That is not a response that we needed that day. We needed compassion. Okay, stigma needed to be removed. Okay, Police do not know how their brains work. Their brains don't work the same that ours do. People in a mental health crisis can be triggered by many things that we don't know. And that uniform alone is a trigger to the majority of those going through a mental health crisis. So we need to stop looking at, we need to stop relying on police and emergency rooms as a place for treatment, because our people are not getting treated that way. I look back at my son being just young, when he was young in school, and how he was criminalized, how he was treated for having these issues, when we should have had more counselors and psychiatrists in the schools, as opposed to 20 police officers. At 11 years old, he was already targeted. So we need to do better. We need to do better. We have the resources to do better. That's why I am totally against police being responders to any mental health crisis.
Thank you for sharing that, Peggy. And thank you. Thank you for being willing to share that story. I think it's really, it's very tragic what you and your son had to go through. And not only is it scary, I think what's even scarier is that there's been a lot of situations that were very similar to that, and yours is actually, perhaps people might say, one of the more positive, because both you and your son were able to walk away alive, which is, I think, really shows how deeply problematic and broken our mental health crisis response system is. And you as a mother have to be, when you're arrested for being for simply trying to protect your son who's in a mental health crisis, and when you call 911 and you ask for EM, and you ask for medical professionals, and it doesn't happen. So thank you so much for sharing that, and thank you for sharing, bringing up the fact that any, and we're also kind of seeing this in the chat. It's really important that any team that goes there knows that they're in charge and does not defer to the police, which is one of the big issues with co-response teams, right? If you're sending police there if you're sending police with them, you're kind of automatically making sure they're going to put them in a position. So thank you so much for that. I want to go now to Public Advocate Jamali Williams. Do you have any personal experience with our broken crisis response system?
No, I've been open about my experiences with mental health, which have been different than mental illness or mental health crisis. I've just been clear that, in the past 4 years, I have been in therapy, and I've always tried to be vocal about that, because certain communities have even more of a stigma. In the Black community, Caribbean community, getting this kind of assistance is stigmatized, and I want to make sure I'm open about that and how helpful it has been for me in just moving forward with my life. I can only imagine if I did have an acute crisis, or I did have mental illness, thankfully I would have access to supports that would have been helpful. But I've also seen when people haven't, and I had a next door neighbor that used to have acute crises at times, and I have seen the police were called, and sometimes it ended well, and sometimes it ended a little bit more with some more energy. I've had constituents when I was in the city council, Dwayne June, who was very well known to that precinct for having mental health issues, and his parents had called previously for assistance, and this time a call ended with Dwayne June being shot and killed. And sadly, that is far too common. It's an issue that I think all of us kind of hear about, but don't have the time to delve into the intricacies. But we have to, because we right now are dealing with a system, as we keep saying, that is treating people who have health issues like they are criminals, and that ends really bad sometimes. And when you overlay that with race and socioeconomic status, it only goes downhill from a place that was pretty bad to begin with.
Thank you for sharing that. Does anyone want to share if they've had any personal, and thank you so much for, you have been very honest and very transparent and vocal about the need for mental health and mental wellness. So thank you very much for that. Is there anyone who wants to share if they have any personal experience with our broken crisis response system? Yes, Tiffany.
Yeah, I'd love to. First of all, I thank the folks that have already shared. But I would like to share a story about one of my clients from my time as a public defender, just because I think it's really important to illustrate the fact that there is, again, that harm that happens with the police interaction, but that is the first piece of harm in a chain of harm, right? Because every single other person that comes down the line after that interaction is just as ill-equipped to deal with the mental health crisis or issue that's at hand. I had a client who, and how it affects entire families, and I think Peggy obviously illustrated that with her story, but I had a client who, she was an undocumented woman, lived in a very small apartment, didn't have access to really any resources. They were really struggling financially. She had a husband that was deteriorating pretty quickly. He was an octogenarian, he was over 80 years old, and she had 2 sons. She had a teenage son, and she also had an adult son who had struggled with mental health issues and also had a developmental disability. And he was 23 years old. So he was, he was a man, a big, strong man that sometimes needed additional help and support. And she had a little bit of a community around her. She didn't speak English. Her neighbors also spoke Spanish. And so they had a little bit of a system together. Sometimes one of the things that he would do was self-harm. He'd bang his head against the wall when he was in crisis. And so sometimes she would call for help and the only number she had was 911, right? And sometimes the neighbor would have to ask for help. And the interesting thing about this story is that actually the people who respond usually to her home were domestic violence officers. And so like you even have some of these specialized units being with particular quote unquote skills or training coming and still being the wrong people to respond, being ill-equipped to respond to this. But there were people that were familiar to the family and it provided at least like a little bit of stability or comfort when those things were happening. And there was a day where he was in crisis, he was self-harming, she couldn't get him to stop. Her 14-year-old son, was exacerbating the problem. And the neighbor called the cops because the cops didn't know what to do. But on that day, the DV team, the response team that usually came that knew the family, was off duty. And so somebody else came and they came in, they were very imposing, they were very physical, things got escalated. And in her being afraid for her adult son in crisis and all of like the upheaval and mess, her teenage son was getting in the way, and she went to physically restrain him to get him out of the way. And she hit him to get him out of the way, afraid of what was happening with her other son. And immediately they made arrests. But because the father was older, was experiencing dementia, and the mother was now being arrested, the adult son was taken to a hospital, right? Orders of protection were put in place, so he couldn't have access to his family, the only sense of stability and safety that he knew. And the teenager went into Child Protective Services. So you had a family that was completely ripped apart. This woman who was doing the best that she could, that really needed a lot of resources. And this was a case that went on for months and months, where we just kept begging, can we please get the family some support? She just needs some help. This is not a situation of a sustained pattern of violence within the home. She's eligible for resources, but she needs help getting them because she doesn't speak English, right? Like language barriers and all these different access, like barriers to access to mental health service support. And her son was deteriorating in the hospital. We had doctors that were calling my office, calling the district attorney's office, begging, saying, listen, you have to drop the order of protection because he's decompensating so quickly. He needs his mother. Meanwhile, his mother, who couldn't have contact with him, was bringing all of his favorite things to the hospital, making him home cooked food, bringing him a pacifier and all of like the things that she knew soothed him. She clearly was a very caring mother and was exactly what he needed. They needed to be together. And to have that be the outcome where the only then response was, well, we have this order of protection. He can't go home. No family members can take him. His mental health is further deteriorating. On top of that, you have an undocumented woman who, if she pleads guilty to this misdemeanor charge, could be exposed to deportation. And then what happens to her family? And then you have a district attorney who is essentially ignoring the professional advice of a doctor saying what this family needed, saying, well, actually, you got to hold this person responsible. And so like understanding the chain of events that happens when the police get involved. I mean, we were fortunate enough, and I even hesitate to say fortunate, that the case ended without a criminal conviction and the family being reunited. But this was an incredibly traumatic experience. And the other thing I thought was interesting and is an important point to make in this, and I'm sorry if I seem a little all over the place, but I remember all of the different times that we came to court on this case. And after the first appearance, the two officers who usually responded to the home came a lot because they cared about this family, like genuinely, the two women. But I only mention that to say that even these well-intentioned officers who weren't there when this incident occurred had sometimes, responded. They weren't equipped to help. They couldn't come in and convince the prosecutor and the judge to do the right thing and follow the advice of medical experts. And so we also have to have this conversation of like, it's not about well-meaning folks in a uniform. It's really about, well, does it matter if they're well-meaning or not if they literally are not equipped to do the job? And you also can't hope that the person that responds to you happens to be somebody that has a certain level of care, compassion, or understanding, because fundamentally, systemically, 99% of the time, your outcome is going to be one that's really, really harmful.
Yeah. Thank you so much for sharing that, Tiffany Caban. It was very helpful to have, I think, that story to really illustrate how on so many levels our system is broken, especially when police get involved, Our next question is actually for Tim, because you've mentioned, we're talking about building alternative response. I would love to hear hear more about Cahoots, this incredible program, which is in Eugene, Oregon. Please tell us, how it works. What have some of the outcomes been, and how do you think it can be replicated elsewhere? Because as you all know, this panel is being co-sponsored by CCIT NYC, which has a pilot proposal for an alternative mental health response in two police precincts, and the team will be composed of a peer and a EMT. So please, I would love to hear, how does that kind of stack up to Cahoots, and please tell us more about Cahoots.
Totally. Yeah. So Cahoots, I'll start off. Cahoots is an acronym, stands for Crisis Assistance Helping Out on the Streets. This program of mobile crisis response was really the natural evolution of crisis services that Whitebird Clinic was already offering. Whitebird Clinic as an organization got its start in our community in 1970 when a group of doctors and other providers were really dissatisfied with the institutional approaches to mental health response to crisis, to even drug use and housing, and really just that there just was a completely inadequate set of resources in our community, and they set out to do something differently. We learned a lot of lessons from the Haight-Ashbury Free Clinic, and brought that back up to Eugene to start what we called the Whitebird Socio-Medical Aid Station. For the first 20 years that Whitebird Clinic was around, we kept getting these calls where somebody say, hey, there's somebody in the park and they just can't make it to the payphone to talk to you, or I don't feel comfortable giving them a ride down to your clinic. Is there anybody that you can send out to talk to them? And when we had the extra volunteer support, we would activate what we affectionately called the bummer squad, right? And this was a group of volunteers using their own resources, driving their own vehicles, getting those calls from the crisis line, and then going out to meet people quite literally where they were at in the community, and then working with them in that environment to really resolve and de-escalate the crisis. At the same time that we were doing that community-based response in the form of the bummer squad, the Whitebird Clinic was establishing itself as an alternative to jail and the hospitals for public safety to take folks when they're in crisis, when they were, really having a hard time, and maybe if there was a drug interaction alongside that behavioral health crisis, that this was an alternative location for folks to go. So we were building the trust of the community in the form of that community-based response, while also demonstrating to public safety that they could partner with a grassroots organization and have some really significant outcomes. Through that process, Whitebird Clinic, which is a 501c3 nonprofit, today we're a federally qualified health center with all sorts of programming. What happened in the late 80s was a formalization of that bummer squad, that community-based response. Through the trust of public safety, we were able to articulate that if we took this program, right, if we took this crisis response and instead of having it tied to a crisis number that folks have to dig through the phone book to be able to find, if it was plugged into that non-emergency number that everybody was calling for public safety, we could reach so many more people. We could reach all of the folks that weren't maybe perceiving what they're experiencing to be a behavioral health crisis, but knew that something felt wrong. And so they're reaching out to the fire department because they want that EMT to come and check them out. They're calling on a neighbor and they want the police to come because something about that neighbor's experience is triggering their white fragility, and the cops need to come and solve this problem for me. So on July 4th of '89, all of that work with Whitebird Clinic with the City of Eugene manifested in the first Cahoots shift. From the very start, the Cahoots program has always been designed around teams of 2 responding to calls for service. That team of 2 is made up of an EMT and a crisis worker. Our EMTs need to be at least certified as a basic in the state of Oregon, but we do have some paramedics, even a couple of nurses that work for us. On the crisis worker side, we're looking for a combination of education and either work experience or lived experience that lends itself to being successful as a crisis intervention worker. We don't necessarily recruit for master's level clinicians because we're not doing diagnostic work and because we're not actually even placing involuntary holds on the patients that we're working with out in the community. For those master's level clinicians who do choose to work with Cahoots, they have a lot of value in being able to support our clinical supervision, facilitating our debrief after really hard situations, and also really, helping us develop a very robust training program. Whether you come to us with 15 years of crisis experience or you're straight out of an EMT program at the community college, that the basic training expectations are the same. And that's about 500 hours of field training, where you start off just observing, really getting to understand what this service model looks like from the inside, and then incrementally applying skills that you develop in 40 hours of class time that we have to complement that 500 hours. So that's 540 hours of training on average. Compare that to 40 hours that an officer is going to go through for CIT programming. As our program has grown, we've been able to really broaden our responses to the point where last calendar year, in a metro area of 250,000 people, Cahoots responded to 24,000 calls for service. Only an eighth of those calls for service involved other public safety resources, and only 150 out of those 24,000 calls were situations where things escalated physically and we had to call in lights and sirens police cover. That's 0.6% of our overall call volume escalating to the point where we need police there right immediately to help us de-escalate a situation. Cahoots staff are always unarmed. We never carry a taser. We never carry pepper spray. For us, the term less lethal that the police uses still indicates that there's a potential for those means to become lethal, and as such, we don't employ them as part of our response. Regardless of the situation that Cahoots is responding to, we're always going to approach a situation with unconditional positive regard, with an intention to provide the least intervention necessary to support and stabilize somebody in their own environment. And all of this is provided with the recognition that the individual, the patient that we are serving, is the expert in their experience. And it's our obligation as behavioral health first responders to listen to that firsthand experience, ask questions, and work together to develop a plan so that as we move forward, we can, as I said, support and stabilize somebody and really, as I mentioned earlier, just meet them where they're at. So often we hear these stories about how crisis response is takes the form of multiple police officers, a fire engine and an ambulance for somebody who's just having a rough day. The whole reason that Cahoots exists on a very fundamental level is that you shouldn't be punished for having a hard time. You shouldn't have to be forced to have police contact just because, for generations you've been oppressed. Just because, you've never had a family member who hasn't been on food stamps. Just because, the chemicals in your brain works a little bit differently and those neurons fire different than mine, doesn't mean that you need to have a police officer. It just means that you need someone to talk to you. And that's really on a fundamental level, why Cahoots is there. We spend a lot of time talking with elected officials about, the financial implications of this program. And what we see in a program that costs about $2.3 million a year to operate is that we're saving our community $25 million a year. That's a 10-on-1 return on investment. But finances, that doesn't really matter to me as much as the fact that this is really just the compassionate thing to be doing. And it has me feeling really optimistic to be in contact with, not just groups like you all in New York, but, small towns in Ohio, Victoria, British Columbia, Miami-Dade and Florida, communities across North America are really looking at what behavioral health first response means. And, I think I'll just end by saying I'm just so grateful to be a part of this all. And, I'm sure through this discussion, a lot of other great questions are going to come up. And I'm just really looking forward to, the rest of our discussion tonight.
Wow. Thank you so much for that, Tim Black. I mean, that sounds what sounds like what you guys are doing in Oregon is incredible. And it's exactly something that we would want to see here. I think something like, we'd want to see here in New York City. I love, from all of it, the fact that people can contact and don't have to call 911. I think that's beautiful. The fact that these are, non-police folks going out, in uniform, it just sounds incredible. I love the fact that, you're not looking for a certain certification. It's really just about, can you do this work? I think that's really, really great. Yeah, Public Advocate Jamali Williams, were you about to? I had a question for you, but I know you might have to be running soon. So can I still ask you, or do you have to head out?
Yeah, I'm sorry. I'm gonna have to jump after. I can answer the question, and then I might have to jump.
All right, excellent. That's very fair. All right. So the question is: so we just heard this incredible model in Cahoots. Folks we've listened to Peggy and Tiffany, even from yourself, folks, sounds like people are really ready for a system that, one, removes NYPD from mental health calls, and two, dispatches, and two, a system that is able to quickly dispatch non-police teams composed of EMT and a crisis response worker. CCIT NYC has said a peer, other folks have said, some type of mental health professional, but for sure, EMT and a crisis response worker. My question is, what can people do, or how do you think we can finally get city council and the mayor to approve legislation that'll do just that, remove NYPD from crisis calls, and to build that alternative system?
One of the things I'm most sad about this past budget is everybody got caught up in so much about the nomenclature of what people were saying when they said defund the police. People just didn't want to hear it. Got caught up in this $1 billion that we never got, and not even close. As a matter of fact, other agencies were defunded far more than the NYPD. We missed an opportunity to have real deep conversations about this. And at minimum, that's what we should have done. And everyone could have been at the table of that. And this was a great place to do that. Just addressing why NYPD is the first responders, right there, we could have shifted a lot of resources. So I always tell folks, don't get caught up in the name, defund, divest, reinvest, whatever you want to call it. It simply means it's an agency that has $6 billion, and we are cutting other agencies. We are telling people we cannot hire any additional doctors, nurses, guidance counselors, social workers, and nothing except for additional police. Now, how does that make sense if we're saying that all of these services can't be handled by police? And so we have put draft legislation in place. We have a report that I invite everybody to go to at advocate.nyc.gov that talks about many of these things of how we deal with structure and equity, and mental health crisis is one of those. And so we talk about getting more funding for mobile crisis teams. We talk about putting the infrastructure there, like respite centers, so we have people, places that people can go. Right now, if you, God forbid, break your arm, you can go to emergency hospital and get attendance and get somebody to help you out. What if you have a mental health crisis at 3 o'clock in the morning? There's not too many places that people can go to. We have legislation that we want to get a new 3-digit number that people can call, so they're not calling 911 and they can get a different type of response. But we have to have political courage to do this. And we have to be able to paint the picture of why we're doing what we're doing. And everybody's screaming at each other and people not having the courage. And I was so sad to see the mayor present a framework that he didn't have to present, that the council had to respond to. But this is where the action is. This is where it is. $1 billion or not, all right? Defund, reinvest, whatever you want to call it. This is the conversation that we have to be talking about. We have to be talking to people like Tim and seeing what can be done if we use our imagination, whether it's Cahoots, mobile crisis teams, PD outside altogether. but someone has to be bold enough to lead that conversation. We didn't have the political courage to do that, and I'm hoping that we do. We have to elect people that have that political courage to do that. I'm glad it seems like we've taken a step in doing that, and I'm hoping to see more. But we have to demand these kind of conversations, and we have to let people understand what we mean when we're saying we don't have a lot of money except for additional police officers who are not trained to do these things, but we ask them to do everything. You know, one thing that really always stuck with me was a few years back, maybe my first or early second term, I was at a press conference with Borough President Eric Adams, actually. So it was probably my second term. It was about gun violence. And a woman came in screaming and yelling, and she got on her knees begging us to help her because her son was in mental health crisis. And she was terrified to call 911 because she was afraid they would kill her son. That's a terrible place to be, trying your best to get help, but you can't even call the police department because you're afraid they're gonna kill your son. Just like Mohammed Ba's mom, who simply said, I called to get to assistance for my son, and now he's dead. Now I'm thankful that to be honest, the vast majority don't end like this, but even the ones that don't end with someone being killed, their whole lives, as Tiffany described, can be wrecked with havoc because they've been introduced to the criminal system. And so we have to call our council members, we have to have one-on-one conversations to paint this picture, and we have to push our mayor to understand this. One of the breakdowns that we had when I had discussions with the administration, things were going well in certain areas, but there was just this refusal, absolute refusal to say that we don't need police to be the first responders right away. And the immediate thing is always, what if there's violence? And we have to break that down because that what if exists in every scenario that we can think of, but we don't send police to every scenario. And so we have to have folks break down, what does it mean? What are you thinking? Why do you think that? Why are we able to send EMTs to all kinds of scenarios, including people who are sometimes who may be in an altered state of mind, and we're not sending police with them, or we're definitely not sending police first. Why is it that we believe we have to send police first here? So we have a lot of work to do. I think there's a way to do it. I'm excited that there's a bunch of elections coming up next year, and so we need to make sure we understand where people are on these issues before we cast our vote, and we have to force them to answer the questions. Don't dodge it. This is not a time to be around and try to get around it. We need you to talk straight to us and make us really understand what's going on and how you're going to help all of the human beings in New York City who need assistance. But I apologize, I have to jump now. This is an awesome conversation. I want to thank you, NAMI, Jamil, and this entire panel that we have here for this conversation. Definitely not the last one. We do have work to do because people are still misguided about what we mean and what we need to happen. But there are resources there, and we have to make sure they're spread out equitably in a way that makes sense.
Thank you so much for joining this conversation. We hate to have to lose you, but we absolutely appreciate your contribution. And we were very excited that we have elected officials like you who have the political courage to talk about mental illness, to talk about mental health, and to understand that we've got to transform and fix the system so that we can save lives. So thank you so much.
Thank you.
All right. Thank you. All right, everyone. So Jamali Williams is left, but now we still have questions. We still have some Q&A. Like, please don't leave yet. You still have me. You still have all the amazing panelists. And so at first I want to say something some people brought up. What is a peer? I think it was brought up and answered a few times in the chat, but I'll just say it out loud. A peer, we use the definition of a peer as anyone with lived mental health experience. And at NAMI, NAMI New York City specifically, we believe a peer also includes a family member. So even if you're not someone who has lived with mental illness or a mental health condition, but you've been a caregiver, we believe that also makes you a peer as well. But thank you for talking about that. All right. Actually, and before we move on to the Q&A, I have the same question for you, Tiffany. What do you think we need to do to to get city council and the mayor to approve legislation that will finally get us that crisis response system that we want.
Yeah, thank you. I think that there are a couple of pieces to this. It's not as simple as saying, well, go out and call your council member and, you know, demand that they do this. One, I think that we need to be very, very intentional about, and building off of what Jamali said, but very, very intentional about what our messaging is. And we have to clearly define it so that the opposition doesn't define it for us, right? And like we saw that in this moment too. You know, you have people saying, well, you know, when they say defund the police, they don't really mean defund the police. Like they mean this. And it's like, well, no, it is what we mean. And this is what it would look like. So part of it is being very, very intentional around language, being very clear about what it means. And then the other thing is really standing your ground. I think that you need to demand solutions that are scaled to the problem, right, at hand. And you really have to be clear about not settling for less. And I think part of the issue with that is that when we do, or when we capitulate, or when we say, well, we're not going to get buy-in unless we give in some, what we then have is a watered down version that that can't be scaled properly and doesn't get the results that we need to back up what we've been saying, what we know to be true, right? Like we see this even in other types of non-police interventions that we try to put into place. You look at gun violence interrupters, for example, right? Like they go into areas, and if they stick to their catchment area and they have the things that they need, you will have neighborhoods that have 0 shootings for a year, 2 years, 3 years. But the second that you ask them to scale and don't give them the resources to do it properly, it waters down their results. Folks then can come back and attack it and say, this doesn't actually work. We need a combination of things. So I think it's also being like really like standing strong and saying our communities should be at the center of care. Our communities know what works, and we will demand nothing less. And a big part of that is also organizing within your communities and having these conversations with your neighbors so that they're also able to talk to city council members, and they feel like they feel empowered to do that they have the tools in their toolbox to be able to go out and ask for what they want and what they need, and quite honestly, what they deserve. And that's some of the great, you know, work of groups like Vocal and Make the Road that make that much more accessible to be civically engaged in that way. But I think that, you know, the biggest thing that we can do to get city council and the mayor to approve legislation is just having those conversations with our neighbors, really, to talk about like what these investments mean and look like, because it is common sense. And when you talk people through it, they're overwhelmingly on board. Like we can create the political will.
Excellent. Thank you so much for that answer, Tiffany. I think it really encapsulates a lot about what we do at NAMI New York City and what Prop does, and our co-sponsors really organizing, having those conversations. And so in that spirit, I want to move to our audience Q&A. And one of the questions that we've gotten is that, you know, what are some objections you've heard to removing police from mental health crisis response calls? And how do you overcome these objections? I think, you know, I'm really excited to hear about that. And let's begin. I'll start with Tim, and then we'll move. We'll start with Tim.
Sure. So I think the biggest thing that I've heard time and time again from folks who are really, you know, skeptical about, you know, having first responders who aren't police is about safety. You know, well, these calls are dangerous. Those people are dangerous. You know, and there's just this pervasive othering that can occur. And for me, when I hear that, you know, what I think about is there was a Stanford study in 2014, and forgive me, I don't have the exact statistics memorized, but what that study showed was that folks who are experiencing mental illness are much more likely to be the victims of violence than the perpetrators. And it is only when those individuals have experienced violence in the last 6 months that they then become statistically more likely to escalate and be aggressive. So there's an environment of you know, that's really, you know, kind of almost like an Ouroboros, right? You know, the snake is eating itself, where there are these aggressive and violent enforcements that, you know, folks experience during that mental health crises. And then because they have experienced that violence, they then become much more likely to engage in you know, physical aggression the next time that they escalate. And so we have to find ways to break that cycle. But the other thing that I hear in that fear is a lack of understanding. When we are confronted with something that challenges our preconceived notions about how the world works, when we encounter something that conflicts with how our daily life operates, it's a normal response to be fearful of that thing, and it becomes easy to other when you don't understand, because that is the most simple way to put it in a box. And as soon as we engage in that othering, we're dehumanizing. And then we enter into that land of enforcement, and it's that same vicious cycle. So I think just to be succinct, and Tiffany, and Peggy, I'd be really curious to hear what you've heard on this. But for me, time and time again, it keeps coming back to this perception that the folks that would be most impacted by having behavioral health first responders are perceived to be so dangerous by the existing public safety infrastructure that they're unwilling to consider an alternative response.
Wow, thank you so much for that. I think, a lot of times people are really, really concerned about, what happens if there's a violent situation or something like that. And it really is, I think you really hit the nail on the head. That is, folks that suffer from mental illness are more likely to be victims than perpetrate violence. And I think also the fact that, what happens if something goes wrong? There's a lot of things, situations where problems go wrong, and we don't ask the police to be there. But then in a way, I think in American culture, we have continuously asked the police to be there in a way. So I think we're kind of seeing the bad results of that. I would love to hear, Tiffany, have you heard about this police question before?
I mean, most often it is centered on this issue of the perceived violence that is going to occur in every single situation when somebody is in mental health crisis, which, like we just said, is simply not true. What I often talk to people about is, can we just take a step back from all of it and talk about what we want our outcomes to be, right? And consistently, no matter where you are on the spectrum, politically, I'm telling you, 99.9% of the time, we always agree we want the best public health and best public safety outcomes. And so the next part of that conversation becomes, well, what if I told you that actually, statistically speaking, when violence does occur, when somebody is in mental health crisis, it is a police officer that instigates that violence. That is when the ante is upped and when violence is much more likely to occur. But not only that, if we want the best public health and public safety outcomes, somebody who is not a police officer, who again only has a specific set of tools in their toolbox and can only go down a specific road as a response to this issue, right? Rather than having somebody who can interrupt and then bring that person to the care that they need, right? Not a courtroom, not a jail cell, but to care and services, which our police officers are not in a position or, tied into systems that can really effectively do that. But the other thing too is understanding that even in when we look at what police officers do, they don't interrupt violence, and broadly speaking, right? They respond to it. They are never preventing violence. They are never almost never stopping violence as it's occurring. They can inject violence into a situation. They can respond after the fact. And even when you look at that, right, that response to violence accounts for a sliver of the actual work that they are doing when they are on the job. And so you just start pulling back the layers and dispelling a lot of these, myths. They just aren't true. And when you hear them, you're like, oh my God, that makes so much sense. And so I think a lot of it is just about having the patience to have these conversations and quite honestly, to approach them in a way that allows there to be a dialogue. Because I think quite often, we go into situations and we say, well, you're wrong. This is how it should be. And this is why you're doing harm. But if we really want to change people's hearts and minds, right? Because also, right, for a paradigm shift, to create political will, to get the buy-in, people have to feel safe enough and open enough to have their minds changed, to learn something new, to internalize it, and then be able to support it. So being able to start those conversations and saying, listen, we want the same outcomes. Let's talk about what's actually happening. and talk about what some of the other solutions where we can get better outcomes from.
Thank you so much for that, Tiffany. Really, really appreciate that. Next question is how much of a role should community-based organizations play in the process of analyzing the problems with our current mental health crisis response system and offering solutions? Essentially, how should community organizations and members be involved in coming up with a new crisis response system? I'm going to toss this out to anyone, but I think I would love to hear from Peggy, especially, if you have a response to this.
Oh, how should we be involved, the community?
Yeah, how would you like to see community members involved?
Well, we in the community are the ones that are impacted the most. So someone that's not from my community can't come and tell me what my community needs. And, from my son, from a young age in school, had they had the counselors, the psychiatrists, and the people that he needed, the social workers that he needed to address the issues from a young age, we would not be having this conversation today. Okay. And when you confront, I look at the way they respond to mental health crises. And when you look at the way they deal with it, had they, I often think of someone in a crisis, right? And when people say, when should we call police? Or, when is it that we should, when we come across a violent situation? So I think the question is, have we done all that we can do at this point? Are you looking at the person and saying, well, let's pull the plug? Because you're saying like, okay, there's nothing else we can do? Or can we say, have we really done all that we can do to help this person? And I think that we have failed in the way that we have dealt with issues in the past. And the Build Communities platform is addressing these issues. And the Build Community platform is part of Just the Issue, which is the community. Vocals, who speaks on the same issues. We are part of the community. It is the community that's taking the time to go and rally and reach out to elected officials and try and make the changes that need to be happening. Us as parents, me as a mother, not only a mother to my own, but a mother who works with those that are incarcerated, that are youth, who have mental health issues, but are being criminalized for it, and they're not being treated. So today, my main issue is not only fighting for my own, but fighting for the many others that I work with and avoiding the way police respond to our issues. So I definitely believe that educating our community, I think that, I know that I have an event coming up where it's educating our community. Our communities need to be educated on when they come in contact with someone in a crisis moment, or when they come in contact with someone that suffers from mental health. A lot of people don't know, they'll call 911. Instead of, if they're educated, would they call 911? No, they would understand that this is a behavior that stems from mental health. We need to teach our children from young about mental health. I think in our schools, many kids go to school every day and they're dealing with issues, and teachers don't want to deal with it. They're like, these are just bad kids. No, they're not bad kids. These are kids who have seen so much. And if you see half the stuff they go through, you would understand exactly what they need. So I think it's just, the community needs to step in. I think us as mothers need to go around. Every conversation we have with someone in our neighborhood, it's letting them know, educating them on what we want to do. Removing police. It's not just removing them. It's saying they are not trained to do what we need them to do. They are not trained. We cannot teach them compassion. We need people with compassion that are trained to come out and deal with these situations. I love one of the things about Cahoots is, they dress in t-shirts and jeans and boots, and they're ready, to deal with the situation, as opposed to an officer coming and is quick to touch his gun, put his hand on his gun, and threaten the person that's in a crisis, which fear triggers someone in crisis. And when they're triggered, you kill them, you arrest them, or you mistreat them, and you put them in an inhumane situation. You put them in a worse situation than they were in. So it's definitely, community definitely needs to get involved. It's by educating, and it starts in the schools. We need to start educating in our schools, and in every forum that we can get our hands on, we need to educate on mental health.
Absolutely. Thank you so much, Peggy, bringing the heat. I think I would say, same question. I would love to hear from either Tiffany or Tim. how do you think community members, how can community members and community-based organizations play a role in figuring out the problems with our current mental health system, crisis response system, and then being a part of those solutions? And I will also just say quickly, I saw someone in the chat say, moms are awesome. And I will say, as the son of someone who is a mother, my mom is pretty awesome. And I think my grandmom is on this chat. So yes, moms are super. So thank you. But yeah, Tiffany, please, what do you think community roles?
Yeah, I think that community organizations and community members have an integral role to play. And like I said before, a community should be at the center of this care. And I think a large piece of that is that there is no one more invested in the care of the folks in their community than the people that live in it, that have ties to it. It feels urgent. It feels tied to their own survival. Like when you have that kind of intimate connection to your community members, it makes a difference to the kind of care that you bring to your work. Certainly, I think that is a really big piece of it. But also, our communities have been starved of the resources they need to prevent things from escalating. And I think that that's another really important piece. And community organizations do the best they can to fill those gaps with like their limited resources. Something that is just simply true is that there are people of all kinds of racial and socioeconomic backgrounds that are struggling with mental health issues, but the people that are getting arrested and the people that are being criminalized and the people that are being traumatized and re-traumatized are the people from the very communities that don't have access to the things that provide stability in mental health and general health and all of these other areas. And so we wait in these communities until we are in crisis, and then we send cops. And so, a big role that these community organizations play is not only being able to provide community members with the tools they need to not call 911 and provide care, in these situations, but also the community organizations are, lobbying groups in and of themselves. And so they play a really, really important role in organizing their communities and creating political will and political pressure to get more resources so that we have other responses at our disposal. Our system, and like very clearly our system of policing, is reactionary in nature, period. There is nothing preventative about policing or a police response. And you can make the argument that, well, you remove somebody from their ability to do harm, but like at some point they are reintroduced to their community, not just in the same condition, but in worse condition, asking for further crisis and further trauma. So I think community groups really, really need to be at the center of the solutions.
Absolutely. Thank you so much. I really, really appreciate that. I want to, since we have Tim all the way from Oregon, all the way from his house in Oregon, I really want to, try to ask him a question about Cahoots. Specifically, people are saying, or kind of asking, how did Cahoots become, the go-to resource in Oregon? How were y'all able to, pardon my, business jargon, but how were you able to scale up effectively, in order so that you guys became that go-to resource? I think there's a lot of organization. How did you guys get to become that? How did you do that, rather?
Honestly, for a long time, we've just been focused on our community, Eugene and Springfield, and really working to build something that was going to be responsive to meet the needs of our community. It's only been recently that we've started to really recognize that there was a place in the larger conversations happening around us to talk about the work that we've been doing. And really, that's a hard question to answer, because it's nothing that we really sought out, right? This is something that folks started to come to us to talk about. And I think that like a good way I could really summarize what we've been doing is that, we're crisis workers, right? We're in the business of crisis intervention. And right now there is a crisis unfolding nationwide. We've been watching it happen for years, but it's really picked up and it's at a fever pitch now. And so what, the work that we're engaged in at Whitebird Clinic and on Cahoots with other communities is really just an extension of the crisis response we do in our community. We're just trying to meet people where they're at, listen to what's going on for them, listen to their experience, and then just engage in dialogue to really find that resolution that's going to work for them. And so, when we talk about Cahoots with other communities, by no means do I have an assumption that what's working for us in Eugene and Springfield is going to be a perfect cookie cutter that we can pick up and just plop in Helena, Montana, or any other city, right?
Yeah.
We have a lot of lessons learned from 31 years of doing this. There's a lot that we can pass on as far as program design, as far as how the service is delivered to the patients and the community. But ultimately, it's going to be a series of conversations, with stakeholders in the community where a new program is intended to be implemented, to really learn about what can be brought, what it's going to look like for that community. With Denver, there's the STAR program, which has started up on June 1st. There are various components of their programming that are distinct and different from the Cahoots model, but overall, what they're doing in Denver very much mirrors what's happening in Eugene. And to start off, they've really looked at where's their highest need area, their downtown core, and that's where it's starting off. And as the program gains traction, and as they gain an understanding of how this service is going to complement other resources in their community, Denver will come up with a plan on how they scale up in their community. Portland, Oregon will look at how they can take a pilot program for Portland Street Response and then scale it up to meet the entire metropolitan area. And it's similar to what we saw in Olympia, Washington last year. Is really, it's just a lot of time talking with folks. We got to learn from each other and really be willing to listen to challenging ideas in order to build something that's going to be really successful.
Yeah, and Tim, can you also just kind of briefly, but can you briefly, I guess, touch on Cahoots' I'm not sure if that's the proper possessive of that, but could you talk about the relationship between Cahoots and the police? Just briefly, a lot of folks are kind of wondering what that relationship looks like. And
so all Cahoots calls for service come through, are dispatched to teams out in the field on the same priority channels as traditional law enforcement patrol. So that means that Cahoots staff are wearing a police radio. We're talking to the same dispatchers. And so that means that officers are hearing every call that Cahoots goes out on. And for that extent, that becomes our kind of our ripcord for when things get real escalated. Like I mentioned, there are about 150 situations on average a year, about 0.5% of our interactions that do escalate physically, where we do need to have support from officers to de-escalate a scene, not so that officers can take back over, but so that Cahoots can re-engage in a therapeutic intervention. So in order to get that resource when we need it, rather than calling 911 and getting put on hold or calling on emergency line, we have access to that radio so that when I really needed cover as a first responder out in the streets, I could get it. The flip side of that coin, though, is that there is a group of civilian first responders who are not sworn officers who are on patrol's channels, who are hearing every dispatch that patrol is being sent on. And that means that when officers are being sent out for that panhandler at that corner downtown, where Cahoots was talking to them a couple hours ago, and we know that there's not, some sort of big unusual situation that's, emerged. We know that this is just, a person trying to make ends meet, in the face of late stage capitalism. We have an opportunity to get on the radio and say, hey, to that patrol officer, we're nearby. We just grabbed coffee, or we're familiar with that intersection. We're never going to acknowledge that we're familiar with the patient because we don't want to violate confidentiality or trust, but we can say, hey, we're familiar with what's been going on at that intersection. We'll drive by and check in with everybody, and then we'll advise you whether or not officers are needed. So we have that upstream check and balance that really allows us to get in there when, something goes wrong with the dispatcher and call taker triaging, whether it's police or Cahoots that go out on that call. But behind the scenes, there's a lot of collaboration that needs to go on in order to have this program really operate at such a high level. And that means that, I'm texting with the chief when there's an issue. I've got that lifeline to him to be able to say, like, hey, look, we got to get a meeting together. We got to talk about this, and the chief is responsive to that. You also see, if you look up some of the recent media coverage about us, even the chief of police in Eugene talks about how officers aren't the right resource to be sending when folks are in behavioral crisis. Even our chief of police is saying that folks shouldn't be locked up in jail just because they're having a hard time. So in our immediate community, we do have to work with law enforcement, because they are the traditional responder, right? Even though we've been doing this for 31 years, we're still a relatively new concept in the game of community policing. So I guess that would answer the question. You know, there is a ton of overlap and a ton of direct collaboration that goes on with officers in order to really make our program work. But that is how we're able to achieve such a high rate of diversion from the jail and from the ER. And further, you know, every shift, every time a Cahoots staff member gets on the van to go out and respond to calls for 12 hours that night, that's 12 hours of opportunity to role model the first responders how you can approach those situations differently when we do end up working on a scene together.
Wow, thank you so much for that, Tim. That was amazing. And the work you're doing in Oregon is really, and the work that you and your team is doing in Oregon is really incredible. And you even did a little sprinkle of impact of capitalism in there. Trying to get me in trouble. I love it. I love it. Let's lighten up the chat.
Yeah.
I think we have another capitalism, the impact of capitalism and mental health. I think I hear another panel on the way. Anyway, so I'm going to turn it back over to you all for closing statements before I get in trouble. But before we do, I just want to thank all of you for attending this panel again. Thank you for our co-presenter, our co-presenter Prop, the Police Reform Organizing Project. Thank you to all of our co-sponsors, including CCIT NYC, Fountain House, the Office of the Public Advocate, and Vocal NY. Really appreciate it. And like we said, like a lot of our panelists have said, the fight goes on. This is not at all the end. We really just see this as the beginning. So later on, everyone will be getting some emails or an email later on with some things that you can do to take action and let elected officials know that you want. We need time to transform our crisis response system. Some of those things include: 1, filling out Prop's petition asking for an alternative system. 2, learn more about CCIT NYC's pilot proposal program. You can Google CCIT NYC proposal. We also will be sending that link out, but it's a wonderful proposal to help right here in New York City. And something you else can do is text crisis to 31 31 31. Again, if you text crisis to 31 31 31, you will get a link you will get a link sent to your phone. You can click that link, type in your address, and it will email your elected officials for you. And you can it's pre-written message, so you can either just hit send or you can spice it up yourself, do whatever you want to it. But again, please, that's crisis at 31 31 31. All right, I'm going to turn it back over to our panelists, our fantastic panelists. Thank you so much for sharing your experience. Please, if there's anything else, what in your last few moments, what are some things that you want to make sure that people understand before heading out? And let's start with Peggy.
Well, in order to make the change, we need to show up. We are the change. It's us. It's our voice. We need to be a voice for the voiceless. We need to show up at every chance we get. And look into everyone who's doing the work. We have a Just Leadership, the Build Communities platform. It's all about, housing and social work and, racism and all those things. We have vocals, vocals. We do a lot of work with vocals. We need to be holding our elected officials accountable. We recently had an action against Melinda Katz. You say this just to get in, but you don't hold to what you say. So we don't need that. Right now, with everything going on, we need people to be held accountable and to do what you said you're going to do. That's what we need you to do. We don't need you to do nothing less. Don't say it just to get in, because we're going to hold you accountable. We voted you in, we will vote you out. Also CCIT, NYC, NAMI, all of you guys, get involved. I encourage everyone to just get involved, be a voice. And, there's some people who say, I don't really know what to do. You know what? No one can take away from your story. Your story is the truth. And once you have that story, you take it and you make sure that you're a voice for every other person that has gone through that same situation. So it's just being out there, being a voice. And that's it. I thank you for allowing me to be on here. Tiffany, Tim, all of you, you're great. Jamil, thank you for allowing us and giving us this platform, to have this conversation on mental health, which is really, really important.
Thank you so much, Peggy. Tiffany, please, any closing words?
Yeah, first of all, I just want to say that it has been a complete pleasure, honor and privilege to be in conversation with you all. So I thank you. But the other thing that I want to say is that I'm really grateful for, programs like Cahoots, because literally you model a different kind of world that is possible. I think a large part where we experience barriers is people saying, well, we can't do that. How do we do that? And we literally see it happening in places, on smaller scales, obviously, where these things work. And it provides us something to point to say, it works, we can do it, let's scale it. And it should become something that is very much so integrated into our infrastructure. It should be replacing the systems that we have that don't serve us. And the other thing that I will say too, is that the things that we talk about, they're difficult. They hurt. They are, full of trauma and triggering experiences. But even in this moment, there's a lot of hopefulness there, at least for me, and having conversations like that contributes to it. I look at this pandemic and the uprisings, in the aftermath of the continued murder of Black folks by the hands of the police. And as awful as it is, we have a window here, and it is laying our systems bare in a way that provides us the opportunity to have conversations at a larger scale and be more successful in them more quickly than we ever could have imagined over the past few years. And so, we saw that when we were told that we couldn't provide housing for people, all of a sudden in the middle of a pandemic, we could house the homeless in hotel rooms. Or we were told that we couldn't have healthcare for free, but we can test for free. And these are in response to a crisis that, wasn't expected, wasn't accounted for. And so what we could do with forethought and preparation and planning, all of these things are possible. And so the one thing I would say that I hope people take away from this is that these things are not an impossibility. We can absolutely make them a reality, and therefore we should demand them and be working towards that and not settle for anything less.
Excellent. Thank you so much for that. And Tim, can you please close us out?
Absolutely. So crisis occurs when a need goes unmet. And when we are looking at how to respond to crisis, it's not just a Cahoots program that is going to achieve the kinds of reform that we're all hoping for. In order to really get to the place that we all want to be, all of us that are in this room having this conversation today, but all of those that are having similar conversations in other communities, it takes the implementation of other things, right? Opportunities for restorative justice, violence interruption, community mediation, improved access to basic human needs like hygiene, food and community. If we can get those things in place alongside that behavioral health first response, then we're going to have the opportunity to really, really live in the world that we all dream of.
Wow, thank you so much for that. I really appreciate that. So yeah, I'm gonna close it out. Thank you all so much for all your amazing expertise. Thank you for our Facebook Live, for folks who are watching on Facebook Live. Thank you for our folks who are watching on Zoom. For more information about NAMI's programs and services, please go to naminyc.org. And you can also, please also look up the information and website for all of our co-sponsors and our co-presenter. Again, thank you so much. And I hope you all have a great night. And I hope you get involved in this fight to reform our crisis response system. Have a good night and take care.
Thank you.
Thanks.